Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before release to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi, and he came here for the Deuk laser disc repair to be done for a herniated disc on his neck, and he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat. My voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to have with this type of surgery. It's all legit. That's all I can say about it.
This is Dr. Deuk. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. It just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yep. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations. Dr. Deuk here. We're just wrapping up our surgery where we did a bilateral L4-5 and a left-sided L5-S1 Deuk laser disc repair. We fixed 2 herniated discs. One was L4-5 on both sides because the patient had leg symptoms on both sides. And when you looked at his MRI, you could actually see the L4-5 disc bulging out on both sides, left and right, hitting the nerve roots coming down. And that's what we found in the operation. And then on the L5-S1, it was just the left side. So of course, to plan out the surgeries for these patients, I look at their MRIs. I get a lot of people online on social media. I see them posting all the time. They're posting their MRI report. They're saying, hey, what do I need done? And I said, I need to see your actual MRI. I can't make a surgical decision just based on a report. The reason is very, very simple. Imagine you were selecting, let's just say Miss Universe, okay? So you're the judge for Miss Universe. You pick the next Miss Universe. And you can either see them, watch them dance, watch them do their things, answer questions, or you can just get a report from someone else who you don't even know this other person, and they just write a report and say, Miss USA is great, she should win. And you're like, well, wait a second, that's not enough information. So when we look as surgeons, when we look at a radiology report, the radiologist is not a surgeon. They don't know what to look for on that MRI, the little details that we're looking for as surgeons to figure out, is surgery going to work for this patient? Is this the right thing? Do I do one disc? Do I do 2? Do I do left? Do I do right? Do I do right, left on one and left on the other like we did today for this patient? So you can't, as a surgeon, we never, ever just go by some radiologist's interpretation, ever. We always look at our own films. And part of our training, we have to go do radiology for literally 7 years, where we're looking at films every single day, making up our own minds. If we went based on the radiology reports only, we would miss 75% of what we need to see. And the results of spine surgery, it would be worse than they are right now in general. So it's very important as a surgeon that you know how to read your own MRIs, and we look at all the images ourselves. So before I made the decision what to do for this patient, I did an interview with the patient on Zoom. He's from the Virgin Islands. Which one? St. Thomas? No, is it St. Thomas?
British Virgin.
I think it's the British Virgin Islands. I can't remember. But he's from one of the Virgin Islands, and long story short, I did a Zoom call. He showed me where the pain was. I got a good physical exam and a good history, and then I combined that with the actual MRI images at the same time. I reviewed it with the patient, and we all agreed that this is what we need to do to fix his pain. And we were able to do that today. The surgery went very well. Now, He's going to be waking up over the next 15-20 minutes. I'm sorry that we didn't have sound. Again, we've been having problems with our audio receiver and transmitter, and we can't get it fixed at this time, but we're working on it. So let's take questions. We do have one more surgery to go. It's a single level Deuk laser disc repair, L4-5, on a patient who's had laminectomy before, he's had microdiscectomy before, and he's now here to have a Deuk laser disc repair. That's a single level left L4-5. That'll be next, coming up in about 45 minutes. But for right now, we're going to take your questions. I would just say one more thing. Check out our website, deukspine.com. And if you know somebody who's having neck pain or thoracic pain or back pain, give them our link, mri.deukspine.com. It's free. It's a consultation. It's me and the person who's suffering, and I look at their MRI. I go over it with them. I listen to them. Where is your pain? How long have you had it? Where does it go? And then I make my recommendation, answer questions. So it's all free. There's no charge for it at this time. That said, also check out our app, the Deuk Spine Institute app, on your iPhone or on your Android. It's free. Again, we try to do as much free stuff as we can. We do free broadcast, free question and answer, free videos, free education, free everything we can afford to do free. We just can't do surgery for free. That's the one thing we can't do for free. We even do consultations here in the office for free. So we try to give as much as we can to people, because we know people are suffering and hurting and they need information, they need answers. So that's what we want to give you. All right, let's go with our first question and we'll give you some answers.
All right, this comes from Jacob on YouTube. And they asked, do you operate many patients with severe ankylosing spondylitis?
Hi Jacob on YouTube, thanks for asking. Ankylosing spondylitis is the topic, and he's asking if I operate on many patients with ankylosing spondylitis. The answer is no. Ankylosing spondylitis is a condition that affects the spine, okay? And what happens with ankylosing spondylitis is the bones in the spine that are normally flexible, they actually start to fuse themselves together over time. And when you look at an x-ray, you'll see what looks like bamboo. We call it bamboo spine on the x-ray. And basically this is like an autoimmune condition where your body is attacking the spine and attacking the discs and the soft tissues and calcifying them over time. It's very, very debilitating condition. People's spines get super stiff. They get stiff necks, stiff backs. They can't bend, they can't twist. And it is not a surgical condition. It's not something we fix with surgery. Now, if a patient with ankylosing spondylitis has an accident, they fall, they can actually fracture their spine, and it's unstable most of the time. They're going to need a fusion done. So no, we don't do the Deuk laser disc repair on people with ankylosing spondylitis unless they're having pain from a disc that is, herniation of a disc, and they have a typical problem like most everybody else. But ankylosing spondylitis itself is not something that anybody should be operating unless you have a disc problem that's causing pain or a fracture.
All right, next question comes from Kevin Harvey on YouTube. And Kevin asked, when should I give up on therapy of a bulging disc in the T8, T9 region and just go get surgery?
Hey Kevin. Kevin is asking, when a patient has a herniated disc in the thoracic spine, T8, T9 for example, when is enough therapy enough? Like, when is therapy enough? Like, so basically here's the answer, Kevin, and this applies to not just thoracic but cervical and lumbar herniations. Therapy does not fix disc herniations, ever. What therapy does that's of value is it keeps the patient mobile, moving their spine, moving their body, walking, bending, maintaining flexibility, maintaining core strength, keeps the patient from just laying around doing nothing on the couch and getting weak and atrophied, okay? That's the worst thing you can do. You get a herniated disc, causes pain, you just feel like laying there not doing anything, right? Well, therapy keeps people from doing that. And that's the only value therapy has. Everyone is misled. They think therapy fixes disc herniations. It never fixes a disc herniation, ever. The only thing that can happen is a disc herniation can start to heal a bit on its own. The inflammation goes down because the activity goes down, and patient feels better for a little while. But they're going to re-injure that disc because it hasn't completely healed. There's a tear inside the back of the disc with jelly stuck in it. It can't heal. It's impossible. The only way to get it to heal is to clean out the jelly, clean out the tear, then it will heal. That's what the Deuk laser disc repair does. So my answer to you is therapy doesn't fix back or neck pain or thoracic pain from a herniated disc. It keeps you mobile so you don't deteriorate and get worse. It buys you time to allow the disc to cool off, start feeling better, and maybe give you some pain relief. Now, what I would say is if you're having pain from a thoracic herniation and you have it more than 2 months, you need to get it fixed. There's only one surgery in the United States that fixes thoracic disc herniations safely, minimally invasive, with a tiny little incision where we go in with a little tube and clean out that herniation, and that's the Deuk laser disc repair. It's done here. It's not done anywhere else in the United States. And that is a very safe, very effective treatment. We've treated now 20 patients with the Deuk laser disc repair for thoracic disc herniations with horrible pain in their thoracic spine. And all 20 patients have had 100% relief of the pain from the disc herniation that we treated. One patient, I couldn't get to one of their herniations. I wasn't able to fix it. So that one patient who had 2 thoracic disc herniations, we fixed one of them. They have no more pain there. Couldn't get to the second one. This is about a week ago. That patient still has the thoracic pain at C2-3 where we tried to get to. Okay, but all the other patients, 100% pain relief with the Deuk laser disc repair. My advice is send us your MRI and let's do an MRI review. All right, next.
That would be it.
That's the last question. I hope you enjoyed this surgery. Our patient, again, is from the Virgin Islands, and I'm hoping that he does really well. We'll know tomorrow when he comes